Providers are assigned a MIPS final score based on their performance across different categories.
Welcome to eClinicalWorks podcast, where we explore the evolving world of healthcare, from key policies and programs to real-life experiences from clinicians and practices using innovative solutions from eClinicalWorks to improve their practices. I'm your host, Marzia Fatima. Whether you're exploring new healthcare technologies, navigating value-based care, or simply looking for ways to optimize your workflows, we've got you covered. Today, we're diving into MIPS, the Merit-Based Incentive Payment System. For many clinicians, MIPS can feel like a maze of regulations, reporting requirements, and financial implications. But understanding it is crucial for maximizing reimbursements and improving patient care. To help us break it all down, we have Sujith Surendran, a product specialist on value-based care, who has worked extensively with clinicians and practices to navigate value-based care successfully. Thank you so much for joining, Sujith.
Thank you, Marzia, for having me.
So Sujith, let's start with the basics. Can you give us a high-level overview of what MIPS is and who is required to participate?
Yeah, absolutely. So MIPS, which stands for Merit-Based Incentive Payment System, is one of the components of Quality Payment Program, also known as QPP, which was part of the MACRA ruling, Medicare Access and CHIP Reauthorization Act of 2015. Under MIPS, providers earn a positive or negative payment adjustment for their Medicare Part B reimbursement based on CMS evaluation of different performance categories. As far as who is required to participate, MIPS applies to Medicare Part B clinicians, and the easiest way to check for provider eligibility is for you to log on to qpp.cms.gov website and enter the provider's NPI, and you can see if a provider is eligible to report under as an individual or as a group. There are few exclusions or exceptions which are defined for organizations or for providers. There is scenarios where a provider could be a low volume threshold, or they could be a new enrollee to Medicare, or they could be participating in an advanced APM. In those scenarios, they could be excluded from MIPS reporting, but otherwise, providers have to report data under MIPS.
All right. And can you talk about the key components of MIPS and how do these components affect the reimbursements for providers or clinicians?
Yeah, absolutely. And providers are assigned a MIPS final score based on their performance across different categories, namely promoting interoperability, quality, improvement activities, and cost. This determines whether an provider would receive a positive payment adjustment or negative payment adjustment on their Medicare Part B reimbursement.
What would you say are some common pitfalls for losing these points?
One suggestion would be for organizations to monitor these data throughout the year and also keep up to date with changes in regulations, which CMS brings forward. The other one would be to focus on the data completeness requirements. There are benchmarks defined for these measures. So kind of keeping up to date with that and the changes would be important. There are also measures which are topped out measures, which could yield them lower points. So it would benefit for them to kind of look into those. We recommend practices to keep appropriate documentation in case of CMS audits.
Interesting. And then initially you mentioned that providers are required to report. What happens if you fail to report, or if you lose points in certain categories? So you mentioned 4 categories. So if you lose points in one of the categories, or you altogether fail to report, what happens then?
If practices fail to report, then they are looking at 9% payment adjustment on their Medicare Part B reimbursement, which is huge.
Definitely. It's a huge impact, financial impact on the practices. Let's talk about what's new in MIPS. So every year there is a change in weightage in categories or some new measures that come out. What's new this year with MIPS?
There are quite a bit of changes on MIPS. PI is promoting interoperability is now 180 days reporting. So proactively capturing these measures is important. Electronic case reporting and immunization practices historically just registered and were in testing phase with the registry. But now they can do it only for 1 year and have to be live with the interface. The other requirement is around PDMP, Prescription Drug Monitoring Program, which is to prescribe controlled substances, is now mandatory in order for you to get any points under the PI category. MVPs, MIPS value pathways, are the newest MIPS reporting option and alternate to traditional MIPS that you can use to meet your MIPS reporting requirements. We already support about 10 MVPs in 2025. Each MVP includes a subset of measures and activities that are related to a given specialty or medical condition. So this could be one of those which organizations could leverage, especially those specialty practices.
Interesting. So with so much information giving, it could be overwhelming for some practices and clinicians. How does eClinicalWorks support the practices with reporting?
Yeah, eClinicalWorks has a MIPS dashboard, which is available for all practices for them to monitor how they are doing for all these three categories, like promoting interoperability, quality, and improvement activities. Cost is something which CMS determines based on the claims which are being submitted. And we have a CMS API connection for us to assist these practices with electronically submitting this data to CMS. We do also have MIPS analyst who works with organizations throughout the year to make sure they're familiar with the program, they understand the program requirements, the setup is done properly, and then also to assist with that submission process in the beginning of the year. We also support MIPS Plus dashboard, which is going to be available in 2025 as part of the upcoming version release, which will allow you to track both individual and group reporting at the same time. Also allows you to see why a patient is non-compliant or not meeting a specific measure, and also help with submission of MIPS value pathways or MVPs.
That's amazing to hear. Because like I said, overwhelming programs, so much changes every year. It's definitely helpful for practices to know that we're here to help them. One last question for you. We often see practices transitioning to new EMRs. How does eClinicalWorks support practices if they're transitioning or considering switching to ECW as their EMR in terms of MIPS reporting?
A great question, Marcia. This is something which we see all the time. Practices switching EMRs. And as far as practices who are transitioning to eClinicalWorks, we assist practices with importing QRDA1 file for their quality measures. And if they've been using eClinicalWorks, the data, what is captured within eClinicalWorks, is also consolidated to finally generate what is called as a QRDA3 file, or assist them with full year submission on the quality part. And when it comes to PI and improvement activities, it depends on when they transitioned. Depending on where they have the data for 180 days available, they could report out of one of the systems, either eClinicalWorks or their previous EHR.
Interesting. Thank you so much, Sujith. This was very knowledgeable, and I'm sure this information is going to help a lot of practices. Don't forget to like our video and watch other podcasts on Spotify, Amazon Music, iTunes, YouTube, and eClinicalWorks.com. From eClinicalWorks podcast team, this is Marzia Fatima. Thank you for watching.